Hi, I'm Shelly Deutmeyer with Physical Therapy Solutions, and today I'm going to be talking about a condition called iliotibial band syndrome. Most commonly, it's called IT band syndrome for patients or in the doctors if you're going to see the doctor for any type of pain that you might be experiencing on the outside part of the upper leg or knee. Most times they have discomfort in the knee joint, most likely on the outside part, and again, it's basically diagnosed through signs and symptoms that you might present either to the doctor or to the physical therapist. We do see a lot of these injuries, more common in runners as well as bicyclists, but again, anybody can get them or get this condition if you have tightness in some of the muscles around the hip and the knee joints. So just to talk a little bit further about what the IT band is and where it is, I have this model here, and what you'll see, so this is the hip on the very top part, and then the knee is down at the bottom. So the IT band is actually a really thick band of connective tissue that runs along the outside. So it's not even really a muscle, it's a very thick band of tissue that connects the one joint to the other. Now there's a couple muscles that attach into this IT band, and at the top you'll have your glute or your buttocks muscle, but then you'll also have the tensor fasciae latae, which is another hip muscle on this up on the outside part of the hip. They connect into the IT band. The IT band runs down along the outside part of the knee and it attaches down on the outside of the knee. So what can be done to help treat IT band syndrome? The first thing that the physical therapist is going to look at is your range of motion and the muscles that are around the knee and the hip joints. If there's an imbalance or tightness in one versus the other, that might be contributing to a tightness on that band that might be causing some pain around that knee joint. The second thing they're going to look at is your hip and core strength. So if some of those muscles that we talked about up on the top part of the hip that attach are weak, and need to be strengthened, that might be a cause for some of the pain that's happening in that area. The last thing that they might look at in the clinic is doing some manual therapy to this area, and with this they would most likely commonly here will use the A-stem treatment that we've talked about in previous treatment videos. So one of the last things I want to show you is a way to stretch that iliotibial band, or to kind of work out some of the tightness in the side part of the hip muscle. One thing to keep in mind is that this is a very aggressive tool. Even for myself, I don't have any hip pain or pain in that IT band area, but when I do this stretch, it doesn't feel the greatest. For that reason, some therapists don't like to use it, but then you're going to find other therapists and other clients that love this tool, and it's the best thing that they can find to work out some tightness in that area and give them relief. So I'm going to show you that next. So for this stretch, we use in the clinic what we call a foam roller. If you've not seen them, they're used very commonly here in the clinics, but they are also sold in a lot of fitness places as well for tools that people use for multiple different things, but this is just one way that we use it here. So we get on the floor with this stretch, and again, a lot of the times the tightness is somewhere in the mid-thigh area. Some people go all the way up to the hip, and some people like down where it attaches down by the knee. So what we'll do is we'll get on your side, and you position yourself over, and you use that roller to roll over that sore area or the tight area wherever you feel. So you might start up at the top and roll down, and then position and get down a little bit lower. So this is, you can get down by the knee, but most people are kind of mid part up to the top part. So again, a few minutes of this goes a long way, because like I said, it doesn't feel the greatest, but sometimes it's a great way to work out some of the tightness that you might have. If you have any comment or any more questions regarding this or anything else with the IT band, feel free to give us a call at Physical Therapy Solutions here at our Dyersville or our Manchester office, or visit our website at www.ptsiowa.com.